We're going to switch now back to Staten Island and Arden Heights, where there was a serious fire today in which 20 firefighters were hurt, 3 of them seriously. It was a serious blaze, started around 1:30 in the afternoon.
Good evening.
The fire commissioner and other
as you may have
officials.
heard tonight, 3 of our members are here in the hospital in very serious but stable condition. At 1:30 today, a call came in a private residence for fire at 88 Shotwell Avenue in Staten Island. Units were on scene in under 4 minutes and found heavy smoke and fire on arrival. They quickly went to work. 11 minutes in, reports of a firefighter down came through. 18 minutes into the job, a signal was transmitted for a trapped member. 3 members were pulled out in critical conditions, and 17 other firefighters have suffered minor injuries. I cannot emphasize enough that this was a very close call for the FDNY. We could have lost 3 members today. But it was thanks to the brave work of our members, including those who went in and saved their fellow firefighters, rescued the trapped members, brought them to EMS on scene, who treated them immediately, and brought them to this hospital, who treated them right away, which is why we are here to say that they are stable while critical, but that they are going to be okay. And I'm going to hand it over to the Chief of Department to talk about fire operations.
Good evening. Our units arrived on the scene. It was a duplex home, a side-by-side homes attached. It was a heavy volume of fire in both buildings. The first engine and truck company to arrive went into the building on the left and started to fight that fire. Quickly after, the second engine and ladder company went into the building on the right. The fire was started in between the 2 buildings in the rear and quickly spread to both buildings. There was a heavy wind condition at the fire, so as the firefighters were inside searching for occupants, the windows failed and the wind blew the fire intensely into the building right at the firefighters. 2 of them became trapped by fire. 1 was able to make their way to a balcony and jump off the 2nd floor balcony down into the driveway, and 1 transmitted a mayday signal that he was in distress and he was on the 2nd floor. Our squad company 8, was arriving just as this happened, and they quickly went to work and made their way, with the help of engine 168, up to the 2nd floor, and were able to rescue that lieutenant from the fire. The nozzle man of engine 168 was working very intense to put the fire out, understanding what the situation was, and he became a little bit disoriented as well. He got hit in the head by maybe falling plaster, and it knocked his mask, his face piece off his face a little bit, and he took a good amount of smoke. So those are your 3 injured members. You know, the wind condition definitely contributed to this fire. Anytime there's wind, the fire will become intense. Also, the heavy amount of fire on arrival was something we don't see every day. But it's all in all, we're very happy to report that the members are in stable condition. It was definitely what we consider a close call today.
And the doctor give an update.
Can you give us your first name, Doctor?
Sure. Dr. Nicole Burwald, I'm the medical director here at Staten Island. B-E-R-W-A-L-D. So as this borough is Staten Island's regional burn center, as a trauma center, this is what we're here to do and what the teams are prepared for. So as we got notice to expect some number of injured firefighters, our teams came into action and were prepared at the bedside to take care of everyone who came through today. As you already heard, an update of the patients, I'll leave that to what we already learned, but really here to say that I feel confident that our teams will continue to deliver the highest level of care to get us through this crisis that is really winding down. We're all happy to see as we take care of New York's bravest here at Staten Island University Hospital.
Questions?
One firefighter, I understand, told a friend who's a civilian, this got away from this. Is that a fair description of what happened?
It's a very difficult fire today.
With the amount of fire upon their arrival and the wind condition, it was a difficult fire. but that's just a term used. It doesn't mean that anything got away. It was a difficult fire that required, us to really work very hard.
Chief, you mentioned the heavy volume of fire on arrival and the fire between both buildings. Was there a space between, because I know they're semi-attached, any idea where the seat of the fire was and what could account for the heavy volume of fire at this time?
Well, the exact cause of the fire is under investigation, but both homes on the rear had what we call a setback, a separate little building. In between those buildings was a space. And where the fire is believed to have started is right in between, those two setbacks, and that's why it quickly spread to both buildings.
Can you describe to us how those 3 firefighters are doing right now? Just, we heard earlier they were alert, conscious.
Yeah, they are alert. They're talking, they're cracking jokes, which we're very grateful for. We are going to monitor them. They are in serious condition, but they are awake, alert, and talking.
Was there a collapse? Were they trapped?
There was.
There was a collapse in the rear of the building on the right, but these firefighters were not affected by that collapse.
2 were burned, 1 smoke inhalation?
There are a variety of injuries among the 3.
So how far away was the setback from the house that caught on fire?
The setbacks, both setbacks are attached to the house, but in between those setbacks was a space. The home is attached, to each other flush, but the setback had a space, and that's how the fire starting there communicated to both houses.
Especially, Mark, we heard it's a fluid situation. What's the total number of injuries now as it stands? Can you bring us up to
So we have 22. 3 of those are critical. The other are minor. They're all to our members, not to any civilians at this time. And just can't emphasize enough the brave work of our members today, and also how grateful we are that their fellow members went to work rescuing them, that EMS was on scene and treated them quickly, and as the doctor said, that the hospital is prepared for exactly this kind of emergency. That's why we have them awake and alert today, and we're very grateful for it.
You said 22?
22, yes. And we can keep you updated if that changes.
All right, thanks, everybody.
Thank you so much.
Chief, what's your name?
John, John.
All right, so getting a briefing there from Staten Island, where heroes saved heroes who were then saved again by heroes. I mean, a serious fire, intense flames, very difficult as they described it. 3 firefighters at times described as being in critical, stable, and serious condition. The bottom line is that they're alert, they're okay after a heck of an ordeal, and their treatment there at the hospital really just pulled them through at the end. 11 minutes in, there was a firefighter down. That talks about how intense it was.
Quick action.
But it ended well.
Yes, and they said wind definitely played a factor in today's fire, with those flames spreading so heavily and quickly throughout those 2 structures. We'll continue to follow developments from there.